Today we're going to be discussing diabetes. Diabetes, what, why, who, when, where. So first, what is diabetes? It's a disorder in which the body's unable to regulate blood sugar, which is glucose levels. Control of blood sugar is controlled by a multitude of hormones, but most importantly, it involves two hormones. One is insulin, which is produced by the beta cells in the pancreas. The second is glucagon, which is produced by alpha cells in the pancreas. There are a number of other hormones that are involved, but these are the two main hormones that control blood sugar or blood glucose levels. You can interchangeably use the terms blood sugar and blood glucose. Blood glucose is the more technical medical term. There are two main types of diabetes. Type 1 diabetes, which constitutes less than 10% of diabetes, and type 2 diabetes, which constitutes more than 90% of all diabetes. Why does one develop diabetes? By the time one develops diabetes, they have lost approximately 40 to 80% of their pancreatic beta cell function. Remember from our previous slide that beta cells are the cells in the pancreas that produce insulin. So by the time you've already developed diabetes, more than half approximately of your beta cells already gone. There is either an absolute or a relative deficiency of insulin as a result. By an absolute deficiency, what we're talking about is the amount of insulin is less. So whatever amount of insulin you had before you had diabetes, now you have a lower amount. When we talk about relative deficiency of insulin, what we're referring to is insulin resistance. So you may have some insulin left, but whatever insulin that you have left in your body is not working well. So although you do have insulin available, your body's cells are resistant to the effects of insulin. Now, who develops diabetes? This is the classic nature versus nurture debate. Now, what is not controversial at all is that both nature and nurture are involved in the development of diabetes, meaning it's not all environment, it's not all genetics. However, what is controversial is what extent both of these play in terms of your risk for developing diabetes. Now, a lot of people assume incorrectly that patients who have type 1 diabetes, and we'll talk about what the difference between type 1 and type 2 is going forward, but people believe that people with type 1 diabetes have more of a genetic predisposition, whereas those with type 2 have less, and it has more to do with lifestyle. And in fact, this is not what the research shows. So one type of study that shows what contribution genetics plays is looking at twins. So if you look at identical twins, if one identical twin develops type 1 diabetes, there's about a 50% chance that the other twin will also develop diabetes. Whereas with type 2 diabetes, there's about a 75% chance if one twin has it that the other identical twin will develop it. So it seems that type 2 diabetes is more genetically linked than type 1 diabetes. When does diabetes develop? So the CDC reports that in the US in 2015, the majority of new type 2 diabetes diagnoses occurred in people aged between age 45 and 64. Age greatly increases the chances of developing this condition, type 2 diabetes. With type 1 diabetes, the majority of cases occur before the age of 18. So we'll talk a little bit more here about what the difference is between type 1 and type 2 diabetes. So in type 1 diabetes, you have an absolute deficiency of insulin, meaning the amount of insulin that you're producing is low. With type 2 diabetes, you may actually be producing a normal amount of insulin, and in fact, early on in the disease, you may actually be producing more insulin than the average person. However, you have a relative deficiency of insulin, meaning the body's cells are resistant to the effects of insulin. So the end product, the amount of insulin effect that the cells feel, is lower. In terms of type 1 diabetes, we don't really know exactly what environmental cues trigger the development of type 1 diabetes. There are numerous theories. Some people believe that early exposure, meaning before the age of 2, of exposure to cow's milk can promote the development of type 1 diabetes. Some people believe that it has to do with certain infections and environmental exposures that people are exposed to, but ultimately we don't really know what causes type 1 diabetes. With type 2 diabetes, as we discussed, there is a genetic component to it, but there are also environmental components, and we know quite well what environmental components cause type 2 diabetes. And that has to do with obesity. The greater your weight is, the more chances of you having diabetes. And in fact, you don't have to be obese, and you don't even have to be overweight. But if you take a very thin person, the more weight they gain, even if they're not technically considered to be overweight, promotes the development of diabetes if they're genetically prone. So with type 1 diabetes, we don't really know exactly how to prevent one from developing type 1 diabetes. But with type 2 diabetes, there is some component of it that's environmental that is under your control. So by promoting weight loss through diet and exercise, eating healthy, you may mitigate your chances of developing type 2 diabetes if you have the genetic predisposition already. Where do we find diabetes? According to the World Health Organization, in 2014, 422 million people in the world had diabetes. The American Diabetes Association reported that in 2015, 30.3 million Americans, or 9.4% of the American population, had diabetes. According to Diabetes Canada, there are more than 3.5 million people, or 9% of the population of Canada, who have diabetes. Diabetes prevalence has been rising more rapidly in middle and low-income countries. There you have it. That is the diabetes: what, why, who, when, where. Join us for future sessions where we'll explore some of these topics in more detail.